I'm very passionate about ensuring women are seen, heard, and properly cared for. So hence today's conversation. Today we're talking about endometriosis and why women living in pain, are dismissed and they don't feel heard, and sometimes they even make women feel like the pain is normal, So we want to have this conversation so we can change the narrative. Um, Before we go into it, I'm just going to quickly begin with this anchor us in this truth. I don't hide what I believe in. And it's from Psalms 139:14. It says, I praise you because I am fearfully and wonderfully made. And your works are wonderful. And I know full well, and this is saying about who we are, how our maker, God has created us. We are fearfully and wonderfully made. He was intentional, about us when he was creating us, basically. So honestly, it's our pain is a sign of that something's wrong. It should tell us something. It should not be a way of life, basically, is what I'm saying. Because let's not pain is not something to be ignored, something that we should understand and get to the root cause of it. So I'm gonna start with you, Dr. Omar.
I
The simple things, And by the way, and for everyone who's joining us, if you've ever been told your period is normal, your painful period is normal, drop a yes. And if you ever had to push through pain, to function, put me in the chat. So for today's conversation, I'm going to start with you, Dr. Omar, and I'm going to ask you about some of the things. First of all, tell us what endometriosis is, since this is what we're talking about today. That condition, endometriosis. Actually, by the way, it's March, and March is Endometriosis Month, Awareness Month. So the condition endometriosis affects millions of women, and yet still remains very widely misunderstood and underdiagnosed. Sometimes it takes a long time for women to be diagnosed with this. So tell us, before I do that, I'm going to introduce both of you first of all. Tell us who you are, Dr. Omar, and then I'll go to Bisoye so she can tell us who we are. So anyone who's listening to us tonight or after this will know who both of my guests today are. So please introduce yourself, Dr. Omar, first, and then.
I'm Kizar Omar, the consultant gynecologist with specialist interest on complex gynecology, condition, and also oncology, including one of the complex gynecology conditions, is endometriosis.
Thank you. Amazing. Bisoye, you want to go?
Yes. Hi, my name is Bisoye Waboso. I'm a project manager and someone that kind of like went through endometriosis and fibroid as well. So I think that's why I'm on the show today.
Yeah, well, we want your lived experience, honestly, because we underestimate the power of sharing our stories. And there is power in that. Another woman can leverage what you've gone through, and she wouldn't have to go through the same thing, or she can find her own pathway to be able to navigate, best options for her, especially around treatment, especially around, how she wants to move on, with endometriosis. Well, you had fibroids, you had a double whammy.
Wow.
A double whammy, I know.
Wow. Yeah. It's too much.
No, it's a lot. It's a lot.
Yeah.
One thing is enough to have both.
Both? Oh my God.
That's just bad. So, Dr. Kazal, we're just going to go with you first. I'm going to ask you to help us understand the basics of what exactly endometriosis is, and the common symptoms, that women should never ignore, and men should help also. Because honestly, some of this conversation that we're having, the conversation we're having is to be able to educate, not just the women, also the men in their lives, to be able to know how to support, and the sons that, in that women's life, and the family member, the uncle, the brother, to be able to also help support women navigating these feminine health issues. So tell us exactly what endometriosis are.
Endometriosis is the implantation of a line of the womb, which is called endometrium, in the part of the body which shouldn't be there. And this implantation, most of the time, is happening in the pelvic area,
Okay.
in the ovary, tube, back of the womb, front of the womb, on the bladder, on the surface of the bowel, in the ureter, in kidney, in lung, and even in the brain.
Right.
So why it is happen and this implantation, because they are not in a right position, it causes inflammatory reaction end up with a scarring, and there is a lot of nerves and tissue would be damaged by this, and affecting, of course, when it is scarring, when it is inflammatory reaction, when it is damaging the tissue, then will be pain. And 30% of the women have endometriosis, as unfortunately sometimes combined with other condition and can be alone.
Like BCOAs.
But eventually it causes other condition also because of the damage is done, and then it causes another problem. So what is the main reason for endometriosis? We don't know. If we know, we can treat it straight away and find it out straight away. But it has a lot of theories. Any disease with the theories, it means that we don't know which one. Maybe genetically, because a lot of girls, they have family history. Mom, auntie, anyone in their sister, they have endometriosis. So can be genetically related.
So will this explain why is mostly misunderstood or misdiagnosed?
Yes, and sometimes, to be honest, when it is diagnosed in the family, when the family member have, it make a quicker diagnosis. When it is the first person in the family to have endometriosis, they will miss it. They will miss it and they will say, oh, or if some member of the family have a little pain in their period, then assuming that everyone have to have some pain. Yes, before having children, the period will be slightly painful, or in teenager when the uterus and pelvic organ not formed properly, can be painful, but not to the extent losing school, rolling around in the house, and also using all the painkiller and have no any effect.
All the painkillers.
So
I hear you.
so that is high possibility of endometriosis. So has to be taken seriously and has to be taken for diagnosis. And the areas, and the second reason, as I said, genetic. Second reason can be when the period is happening, some blood, or most of it, coming down through the neck of the womb to the vagina and out, but some of them go around the tube back to the tummy wall. And of course, the period also have cells, and these cells implant, and then next time respond to the hormone.
Wow.
And the hormone is mostly estrogen. So that is another theory. The other theory is saying that the embryo, when it is in a mom's tummy, the cell from the line of the womb, we are very complicated creature, and when it is formed, some of the cell can implant in the other side. Why they saying that? Because sometimes people having a cesarean section, suddenly some cell from the line of the womb implant on the cesarean section and grow. Or I have seen it in the episiotomy scar. So can implant, can be. But why it is present in the kidney? Why is present in the chest? Why it is present in the brain? So they say possibly going through the blood vessel, or possibly going through the lymphatic vessel. So as I explained, there is many theory. So which one you cut, which one you prevent, there is nothing we can do. Hopefully one day we find out something which is curative, not curative, diagnostic, and this diagnosis which lead to prevention, because prevention is more important than treatment, because treatment can damage and damage and damage and also only by treating endometriosis, not the endometriosis only by itself can affect the fertility. By treating them, also affect the number of eggs in the ovary and cause infertility and cause premature menopause. So treatment by itself, yes, it is very important to diagnose it early, but slowly will affect that person and also cause scarring, and the scarring affect the nerve, and the pain can be the same. You say, oh, there is no active endometriosis, but the woman is in pain. And the amount of pain the women have not usually reflect the severity.
Right.
Sometimes very mild endometriosis can cause a lot of pain because they grow in the top of the nerve and continuously stimulating. It's like electric shock continuously. And some people, they have severe endometriosis, would damage all the area, cause scar, nerve is dying, so they have no pain. And they'd be surprised when you do laparoscopy.
Wow.
Yeah. Surprised when you diagnose them when you're doing something else. So that's the problem with endometriosis.
Yeah.
The
And for me, and for
sorry.
me, the scary bit is how it can be found in other parts of the body, like other
Yeah,
organs and all of that. That's
yeah,
really worrying,
yeah.
and
And
the travel there.
scarring can cause, for example, scarring can make the ureter to be blocked. I have seen people with renal failure with endometriosis of the ureter because this is a
Wow.
tube coming out from the kidney. And that person doesn't know. Slowly, slowly, they can have one kidney not function, other kidney not function because the urine, when it come down, has no space to go or have a very little space. It return back, causing flank pain. Slowly, slowly die down the structure of the kidney. The other
Wow.
one can invade the bowel. If it is too much, they end up with stricture of the bowel. They end up with constipation. They end up with bloating. Again, in the chest can cause also a lot of coughing, blood.
So will that also be a symptom?
Oh yeah, coughing
Oh,
blood sometimes.
wow.
Why you having coughing blood either 25-year-old or 20-year-old, and then they mistaken with a cancer or something like that, and they found
Wow.
out when they take a biopsy. I have seen by myself a woman came with stroke, a sign of stroke,
Wow.
and it was endometriosis in the brain because it bled. So
Wow.
anything in the brain bleed, of course, it goes like a stroke. So she had endometriosis of the brain. So it is a nasty benign condition, but it is a
Wow.
nasty condition. So the
Wow.
women have to know if they have pain, and sometimes they start before the period. The pain start before the period, few days more than sometime a week before the period. When the
Right.
period come, it exaggerates. And slowly, slowly, in the last few days of the period, it settle down, then start again after. So their pain is not only during the period, start most of them before the period.
Before.
Yeah. In
Wow.
addition of heavy period, because it's all congested, the area is all congested. And also there is a condition, it is associated with endometriosis, which is the endometriosis in the wall of the womb. They call it adenomyosis. So the adenomyosis is enlarged the womb. When enlarged the womb, the surface is very larger than somebody else. The muscle, they are weaker, so they don't squeeze during the period time, so the blood coming down. So heavy period, congestion, all the area is inflamed, so it causes heavy and painful period.
Right. Oh, wow.
And
Amazing. This is interesting to know, honestly, especially around endometriosis and some of the symptoms you've mentioned. And I don't think that's something, I mean, what I've always thought it was just period pain. No, so you're talking about cough, if especially if the
yeah, yeah,
endometriosis is somewhere else, somewhere else in the body of
yeah.
a woman. That's interesting. I think we should run through a list of some of those symptoms
Yeah.
that women shouldn't ignore, especially if it's is also
Mm,
alongside with period pain that comes
mm,
before the period, not
mm,
during the period.
mm,
And I think I've heard you say.
yeah.
Before I then
And,
come to Bisoye, so she can tell us how she discovered,
and,
how yeah.
and when it is in the ovary and making the cyst, which is called endometrioma,
Mhm.
also have pain during ovulation. So the women come, say, in the middle of cycle, I can't feel when I'm ovulating, and just like blowing things in my stomach. So
Right.
this is another one. And another one, which is very, very bad, even if it is not in the lumen of the bowel, when it is between the bowel and the womb and the neck of the womb, it causing them so much pain on passing motion. 1 minute
Wow.
have diarrhea, the other minute have constipation. And lots of women has been mistaken with IBS.
Oh,
They call
wow.
it, yeah, they call it tenesmus. They've been mistaken with Crohn's disease. So they have diarrhea, constipation, very painful. They are afraid to go to the toilet because it's so painful. The other one, passing urine, is painful because it is on the surface of the bladder. They go to urologists.
Wow.
They have a camera inside the bladder. Bladder is normal, but in the surface of it, when the bladder contracting to pass the urine, is so painful.
Thank you for that, Dr. Omar, because it's interesting. I was having a conversation with a girlfriend of mine recently, and we were talking about fibroids, and all of that, which is what
Mm,
she thought she has. And
mm,
now you saying about it's difficult to pass urine and all of that, those are some of the symptoms that she's got. So I wonder
yeah.
if she's what checking if it's endometriosis as well. And
Mm,
interesting,
mm,
that you say all of these things because this
yeah.
must be why it is difficult to diagnose really, and it
Yeah.
takes longer, to be
Mm,
able to. Oh
mm,
wow! Because all of
yeah.
these symptoms are also symptoms that you can
Mm,
have other things. So usually
mm,
women are checked for those things, not endometriosis.
yeah. And
Could
also
there
they
be any
have,
reason for you to then have kind of like fluid buildup in your stomach because of it?
yeah, because when you have, for example, the cyst or inflammation anywhere in the body, inflammation when it has happened, like a blister or burn,
Mm.
okay? And the blister of burn have a fluid.
Wow.
They pop. So you see the fluid, unless if the woman have no, because sometimes after ovulation there's a fluid in your stomach. But the inflammatory reaction everywhere, it makes fluid. When you have a cut in your hand, if it is like inflamed, then you see the watery discharges coming through. So that's the same. In your inside the body is causing that. In
Wow.
addition, it caused nerve damage. A lot of women
Mhm.
have been through the physiotherapy, rheumatologist, orthopedic surgeon, and it is because of the nerve. The nerve is so being invaded. So they have back pain like sciatica, they have hip joint pain, they can't walk properly. The pain is radiating to the bottom, to the buttock, to the front of the thigh, inner of the thigh, like how the woman giving birth.
Hmm.
So these are also other symptoms.
Wow.
And they've been through all those specialty. Then at the end, nowadays, the ultrasound is very easy, but if it is not making a cyst or some scarring obvious,
The
it cannot be
ultrasound can miss
diagnosed.
it. Oh wow.
They will miss it. They will
Oh
miss it.
wow.
And in addition, the woman may have very irregular bleeding. Sometimes they say, "Oh, I have two periods in a month." Why you have two periods a month? Because the ovary been damaged by endometriosis, so the hormone is imbalanced. So it doesn't produce proper ovulation and hormone in the same time. So it's causing just like irregularity of the period, like congestion of the womb, congestion around it. It's
Oh
like you
wow.
are on a fire all the time, to be honest. I have seen women and you just feel really crying for them
Ooh.
because it's like you are on a fire, your pelvis is on a fire. So
All the
these
time.
are and in addition of infertility. If damage done, infertility is really waiting.
Oh wow, this is really enlightening.
Mm,
And
mm.
what I'm hearing is this is not just a bad period pain, it's a serious medical condition.
It
Yeah.
Honestly,
is. It
that
is. Mm, it is.
wow,
Mm.
that
And
so you
infertility
you talked
treatment.
about I'm going to ask Bisoy now
Mm,
to share her story, but you talked
yeah.
about find
Mm,
diagnosing this. So I mean, you mentioned a few things. What's the best way for a woman when you're suspecting all of this? Well, I mean, with some of these symptoms, combination of these symptoms that you've mentioned, that I mean,
uh-huh,
it's never
uh-huh.
even been a thought
Yeah.
that that might be
Endometriosis.
endometriosis.
Endometriosis have four stages.
Okay.
Right? Yeah. Stage 1 and 2 is
Mhm.
difficult to be diagnosed by ultrasound and even by MRI. When it is a beginning, when you're thinking, especially if you do investigation for the teenager, early 20s.
So
But
you're
when
saying you
becomes,
can't pick it all, you can't pick it early.
you can, but by laparoscopy.
Ah.
Yeah, you
Ah.
can, but by laparoscopy, not by ultrasound, because ultrasound can be normal and there is endometriosis plugs, like a plugs inside the pelvis organ.
And to get laparoscopy doesn't mean that because you have a combination of these symptoms, you get offered laparoscopy. I mean, as
but stage 3 and 4,
diagnostic,
which is late, even by examination, you feel that the womb is not moving, the examination is too painful. They can't even have intercourse because it's so painful during intercourse. So some of them, they say, I'm infertile, but I can't have sex because of that.
Yeah.
So if you remember, the girl said that was her in the meeting, that was third laparoscopy. Wow. And that is every time they have a laparoscopy, they separate something, they feel good for a while, and then start again.
Again. Oh, wow.
Yeah. And the eggs also, number of egg will be dying, and fertility is affected by the structural problem. Their tube can be blocked by scarring. When the tube is blocked, then fertility is involved. When the ovary is not working properly and their eggs is coming down, that's another issue. When the uterus have adenomyosis, implantation is very difficult and is not easy to be done because it has association with other abnormality. So all these even interfere with the IVF success, because fluid of endometriosis can kill the embryo.
Wow.
Yeah. Wow. Yeah. So the fluid, as you said, is there fluid inside the tummy? Yeah. Because of the inflammation, the fluid of endometriosis can kill the embryo. Even if it is fertilized, even if try to implant, it end up with miscarriage.
Okay, you can imagine. So if you didn't know you had endometriosis and then you're trying for a baby and you do IVF, that can even be the causes of losing, the fertilized egg.
Yeah.
Wow. That's really something to know. And wow, thank you for that. That's a lot to download and to just get my head around.
When you talk about it, no? You
have really put my head in a different space with all of this that you revealed tonight. Thank you for that. I'm going to go to Bisoy quickly so that she can share a bit of her journey with us.
Yeah.
And then we'll come back to you, Dr. Omar, because this is a lot of learning this evening. Thank you. So Bisoy, thank you for joining tonight. And I'm sure that listening to Dr. Omar, you're thinking, oh my God, so that was what that was what was going on. So share a bit of your journey with us. When did you first realize something wasn't right? And then what challenge did you face because with all of these many things, many symptoms, what challenge did you face in getting a diagnosis?
I think when did I get to know,
or the things that you were complaining about?
Yeah, I think one of the first things that I noticed basically was the pain. Obviously, because I was staying in Nigeria before, having serious menstrual pain, it just didn't occur to me that it could be any problem. It just felt like, okay, my own menstrual period was different from every other person.
Right.
To just regularly having constant serious menstrual pain. I had heavy bleeding, but it wasn't bleeding that I was like, oh my God, this is unusual. And then when I came into the UK and 5 years into marriage, and I was like, it dawned on me that, come to think of it, I've not even once conceived, not to talk of having a miscarriage. That was when I was like, okay, is something wrong? Let me go check, blah, blah, blah. And then I went to check, and then I was told then that I had fibroids, and that I had multiple fibroids.
Okay.
Then I was like, oh, okay, and stuff like that. And then I was able to, the first pregnancy I had a miscarriage, but I didn't think of anything unusual. Okay, it was just a miscarriage. And then I conceived again, and then I was able to have my child. And then after my first kid, the bleeding now became so unusual because it was like I had to sit on the toilet. You can't move, you can't do anything. It's just like it was just gushing out. And then I'll get so pale because I've lost so much blood and stuff like that. But as at then, I still was like, okay. And then the straw for me was when I now had my second son, because it was just like, that was now the trigger. because it was now unstoppable. The pain was unbearable. We had 911 as the speed dial on my phone. My husband had that on the phone, because whenever it got to that stage, because there was no painkiller you could take. There was no painkiller I could take that could work. They tried, I've been to hospitals and they'll give me cocodamol. I've tried really, really strong painkillers and it just wasn't working
So
for
at
me.
this junction, were you thinking it was because you haven't been diagnosed with endometriosis? It was just, so you thought it was just fibroid that you had that was
It was fibroid that I knew first that I had, and that was when I was trying to conceive my first child, blah, blah, blah. Okay, I had fibroids and all. So there was a time in there that I then had to do like an endoscopy, or kind of like the one they put inside. I think that's the one. Yeah. And then that was when they said, oh yeah, I had endometriosis. And I was like, what the hell is that? What does that mean? In my head, fibroid, okay, fibroid, I get that. But the endometriosis was when they were not trying to explain to me, was when the lining of my womb is kind of
and this
like
was after you
outside.
had your first child.
Yes, that
Was
was
after your
when
first child, yes?
I knew. After the first one, yes. After the first one. And then the bleeding started, but it was after my second son that it was just like the tap couldn't switch off. So because after I had my second son, the bleeding was just uncontrollable. I was bleeding for a whole month. I could be bleeding. And when I mean bleeding that I can't even sit, I can't lie down on the bed. I couldn't sit. At night, I'm always just sitting down, and then my husband will put a pillow for me because there's no point getting up. There was literally no point. It was that bad. And then the pain, we were just used to just dialing 999, and then I go into the hospital and they pump me up with morphine.
No, speed that.
It was unbelievable. I can't put it to words. And my husband then had a friend that was a gynae. And then he was always like, what is going on? What was this? One can't just be losing blood like this. Fibroid is not that bad. That was why I kept on saying that, what's going on? And then that was when he was trying to explain to me that, okay, if I'm still planning on having more kids. I'm like, whether I'm planning to have more kids or not is not even
You want to
up
just
for
live. You
discussion,
want to be
because I
alive.
need to live. I need a life. I need to live. I need the ones that I have. I need to be able to take care
Look
of
after
them.
them,
I
right?
need to be able to. Yeah, I can't do anything. I can't do school runs because before I even get to the car, I'm all
I can
soaked
imagine.
and stuff like that. When I'm going to the office, I wear black jeans. By the time I get back, I'm all soaked all
Wow.
through. So
Wow.
it wasn't just life for me. And I just wanted, anything anybody could have said to me that would stop that, I would have jumped at it.
Okay,
So
so
I
I can
wasn't
imagine
thinking.
how that will have impacted you also emotionally and mentally, because
Yes.
it was just you surviving really and trying to.
Yeah.
Wow.
Was that surviving? That wasn't surviving.
Well,
I don't
you
think that
wanted
was
to live.
surviving,
You weren't thriving. You were just like trying to, okay,
because it
what
was just
exactly?
like,
Wow.
what's
So I'm going to
going
come to
on?
Dr.
What's
Omar
going
quickly
on?
before, because I wanted to ask her. So Dr. Omar, now because Bisoy has had both, because Bisoy
Wow.
same thing I
Wow.
took out her uterus.
Wow.
But so because she had fibroid as well as endometriosis. So at what point was it that endometriosis was what was causing her problems, not the fibroid? With some
Not the
things that you
fibroid,
just
yeah.
shared with us.
Well, also both of them, they were hormone dependent. The fibroid is hormone dependent, endometriosis hormone dependent. So you had exaggeration on both of them, and they're adding together. God help you.
God help you. Sorry. Oh my God.
God help me.
How old you were when you married?
Sorry?
How old you were when you married?
How old were you?
I got married at the age of 24. Yeah, I think 24,
Because
25.
at least was early age marriage, which maybe the endometriosis was not made too damaged, and you get pregnant, and maybe the fibroid was not in there, and also the pregnancy by itself calmed down the endometriosis, and as soon as your pregnancy done, then the endometriosis start flare up.
Can you imagine?
Yeah, I think that was what happened. I really think that was what happened, because as soon as I had my first son, it was like I couldn't get the tap to switch off, because it was constantly in pain, constantly bleeding. When I mean bleeding, I mean clots, like kind of like clots, just plop, plop coming down. Like, this is not normal. This is not normal. So when the idea of even having an hysterectomy and then that would stop it, I just jumped at it, that, you know what? I don't want to know
You just
whether I want
wanted to
children or I
get your
don't.
life back.
I was like, oh yeah, have a discussion with your husband. I said, no, there's no discussion. It's not up for discussion. You need to leave.
No,
I'm
I
not
hear you, and thank you
discussing
so much.
anything.
Thank you so
Go
for
for
sharing
it.
your story. And that represents some women, you know, who they don't even have words to begin to describe the things that they're going through, you know, because either they still even don't know that they have endometriosis because they haven't been properly diagnosed, honestly.
Yes.
And they might not have a platform or somewhere to share their story like you're sharing today. So thank you so much, you know, for sharing your story and your journey. Oh wow, that's quite something. Honestly, to have both is double whammy, and I understand that.
Double, yeah.
Sometimes we think, oh, it's just fibroids we're dealing with, because that's what we've been told, and that's what can be seen. Because, like Dr. Omar said from the start, you know, some of this endometriosis,
You don't see them.
probably hiding in some other places you don't even know. So what they saw first with you was just a fibroid. So, oh, you've got fibroid, and so that's what you said, you know. Alas, endometriosis was somewhere in the corner somewhere, and he was waiting to show his face.
To be triggered. I think he was just triggered.
Wow.
Yeah. It's difficult. It's very difficult situation. But I have seen it. 3 patients for last year in 2025. They had both. They have fibroid and endometriosis, which is so unlucky.
It's the pain is unbelievable. So,
So quickly, I'll ask you, Dr. Omar. So what practical steps should a woman actually take if she suspects she has endometriosis? Because now some of the symptoms that you've said that, you know, I didn't even think was a thing, like coughing, like, you know, what should a woman do if she suspects that, okay, maybe I have endometriosis, maybe she's listening to us tonight and she's there, some of the symptoms you've mentioned, like, oh, I have combination of all of these things.
So basically the pain, mainly the pain, when they have a severe pain and pain relief, any analgesia, not relieving it, even not touching it, and this is going on and on. And some of the young people, especially when they have period around 12 or 11, for the first year or 2 years or 3 years, may not have that problem because it is not growing yet, because it depends on a hormone. It's the estrogen dominant. So it take like age of 15, 16, then they miss school. They can go to school, or they are at school where as soon as they have a period or pre-period, they have to call their parent to pick them up because they can't stay in the class. So these are a trigger. These are a trigger. You learn from this. This is not normal. Why my friend have not this problem? Why I have this problem? Then slowly has to be diagnosed. Yes, as I said, in those ages, I am sure the ultrasound always normal. Rarely you can see a cyst which is called endometrioma related to the endometriosis in the 18, 19-year-old.
Right.
So then when the scan is normal and the pain is going and you try pain relief, most of the time also just say, oh, this teenager, we not expose her to the general anesthesia or anything like that. Can we just try? We give them a pill. If the pill, but not monthly, it's better to like experiment, like trial of error. If the pain set, for example, if the girl had like 3 months in a row and is better, it means there is something wrong. Because three pack of contraceptive pill, it means that there is something wrong. Why the pill is covering?
So can you say that again, please? So if
monthly pill, in addition to lifestyle is very important.
Yeah, we'll get to lifestyle. But tell me, because I'm trying to get to how.
But
Find it early.
But sometimes some girls are reluctant to have a general anesthesia and having a laparoscopy. Of course, nothing is out of danger, and some girls, they don't want to be having any surgery, or parent or family. So what we do, we give them, if they have no migraine, we give them combined pill. Combined pill, we tell them tricyclic. Tricyclic, it means continuously 3 months in a row without any break. And you see that girl, oh my God, brighten up in that 2 months, because have no period, no pain. The third month when they come, they say, my God, I wish I never stopped it because it's pain again. So that's a trigger, because it shouldn't be painful that much. That's a trigger, will tell you there is something in there.
Something to investigate further. Right.
And unfortunately, in the past, when the endometriosis was not very famous, people were not aware of it. I have seen girls saying, because of my heavy period and my painful period, I've been on the pill for 10 years.
What?
And then
Wow.
you diagnose it. Yes, because
10
they were told
years.
10 years, yeah, or 15 years. 10 years is very common, people on, because they were told this pill, take the pill and you'll be fine. So the diagnosis been delayed, but diagnosis in the beginning, now we are facing a lot of teenage, early 20s. They know in the social media, and they know about endometriosis, and they come, they say, I don't care, I want to be diagnosed whether I have it or I haven't. If I haven't, that better. If I have, I can deal with it and I can treat it.
Yeah,
Yeah.
absolutely.
Mm.
And especially
So
around
there is a
lifestyle.
treatment for it. Is that what we're saying? There is a treatment for it.
And there is a suppression. We have no final treatment. As you have a hysterectomy or you don't, that is a treatment. But basically, we
Oh.
suppress it growing. Most of the time, is hormonal. Suppression of the growing of the endometriosis is hormonal, either combined pill or mini pill or injection or implant, or also there is another type of like mini pill but different, which is specific. Then if the bleeding and pain is too much, we break all the way from the top of the brain till the ovary. We break it, we cut it down by other type of tablet, which is called Raiko, or you
Oh,
call it Yazalti. So those things also is new. They are new. They are new. What it does break every single pathway of hormone, and like suppression, you suppress, but they can't be pregnant during that time. You have to tell them, because they can't be, because suppression of everything. So it is basically hormonal treatment. It is periodically, like quick fix for now, and can we see later, or
Okay.
avoiding to progress to the other stages and stages. And the laparoscopy, when we see, if it is a cyst, we take it out. If it is like a brushing of endometriosis, which stage 1, we laser it. Stage 2, there is like a nodule, you can excise it, especially if it is better not to touch too much ovary, because you're losing eggs. Other part, you excise those nodules, and then you give them a hormone to hopefully not coming back, because sometimes you excise or treat endometriosis in one place, then after 3 years when you do a
We
laparoscopy
go
again,
somewhere else.
it's some.
somewhere else.
I was gonna go to that. So my
Yeah,
next question to you was going to be: so this is the ones that you can see that
yeah,
you take
we
out or
treat.
treat or
Yeah,
whatever.
yeah,
So what if it's gone to where you didn't say it, or where you can't even reach?
yeah. The you can't even reach is the one which is inside the organs. That is
Yeah,
a
that's
very
those ones.
difficult
That's
one.
what I was thinking about.
So far in my whole career, I had a lady, she had very mild endometriosis in the inside the pelvis, but have very heavy and painful period. That was the first time in my life I saw the endometriosis in the vagina.
What?
In the vagina. Yeah.
Wow.
And she brought me her daughter now, and the daughter have endometriosis.
Oh, God.
So she ended up herself with a hysterectomy because of the bleeding. But she had only mild endometriosis inside. But she had, and I had to laser the vagina. Imagine. That was the first time. But the one, for example, in the ureter, which is the pipe coming from the kidney to the bladder, sometimes you cut the part which is blocked and then you reimplant it again. The bowel, that's a stage 3 to 4. Part of the bowel has to be resected and then end-to-end fixing it up. Some people, they have even colostomy for a while until they fix that up. So it's a nasty, nasty disease.
It is.
And one of my patients, she has been all her life in a lot of pain because of that. She had a little tiny lesion in her down below. She said, "Can I have general anesthesia?" I said, "Why? This can be done under local." She said, "I've been through so much pain. I can't tolerate even a side of the needle. I don't want any needle. I don't want any local. I want to be asleep to have that little thing done." So it is, and I have seen people staying in the hospital for months and they are on crutches.
Wow.
Yeah,
Endometriosis.
it's like a disabled, yeah, like a disabled woman, and she couldn't even walk properly.
Wow.
And people, if you have irregular periods, say irregular in the sense that maybe your period is, instead of 28, you have like a 20-day cycle, could that be because of endometriosis?
Dr. Omar, did you hear that? Are you there? Oh, I hope she hasn't dropped off. I can't see her. Dr. Omar, we can't hear you. You're muted if you speak it.
You think she's muted?
Can I again? Dr. Omar, you want to go out and rejoin? It would be good to see your video too if you can. We can't hear you. You're muted if you're speaking. Okay, whilst we're waiting for Dr. Omar to show you, oh wow, some of these things that Dr. Omar just highlighted for me is, ooh, that's a lot. That's a lot. Whilst we're waiting for her to come back, so for
That's a
you,
lot. There are a lot of things that I didn't, one wouldn't have known that.
it's some of those symptoms are just like, oh wow.
Why would I even think that, okay, this could be the problem? Because it's not that, wow, that it can even go to the brain, go to
Yeah, actually, it can
other.
be in all
I
different
didn't even know
organs.
that.
You know,
Yeah.
I wanted to touch on lifestyle with Dr. Omar before we can't even find her now. Can someone help me reach out to Dr. Omar and see if she's okay and is she going to rejoin? Florence, can you try and reach Dr. Omar, please?
But at least with kids, one can just start, especially for us that do have
Young children, honestly,
girls
start to
turning into teenage. So one can
start
just
to
be watchful
investigate and
if
make
there's
sure that
anything.
it's.
That's why I'm asking
I
about the
know, I
period
hear
thing,
you.
so I can just start taking records. So if I know your period should be 28 and it's 2-3 days less than that, that's a trigger. So one should just want to know if it's like 20 days, is 28 the norm? Is 20 abnormal? You see what I mean? Or
Yeah.
is
No,
it
let's
just
wait for
that it
Dr. Omar
varies
to
from
come. But
people
when
to
I was going
people?
to ask you, so when you found out about endometriosis, so what did you start to do differently, like lifestyle, or what kind of support or education did you start to get to help yourself or to help you navigate it?
With all honesty, I didn't do anything because I didn't know any better, and that's the truth. So because when I knew, okay, I had endometriosis, when you go to the hospital and you're going there because you're in pain, they're just talking. And all what you're just thinking is, okay, what can I
Take
do to
away
stop
this
the pain?
pain.
So everything they were saying was probably going in and coming out. All I was just interested in, just give me what will relieve the pain.
I hear
So
you.
I wasn't doing anything different. I wasn't saying I wasn't taking any food. It didn't even occur to me that I could eat any type of food to ease this, because you're losing a lot of blood. There are lots of foods that you can take to kind of like replenish so you're not anemic. I didn't even know that. I didn't know that. I was just too focused on the pain and the fact that I can't do anything because you're getting up, you're bleeding. I'm just constantly on pad, on tampons and stuffs like that. Was my mind, everything was just on that. So at that point, I didn't do anything. What would I have loved to have known?
Yeah.
Probably someone that one could speak to, because at that time as well, I didn't, maybe, people were quite good in covering whatever situation it is that you're going through. So
We
it just
don't
felt
talk
like,
about
okay,
it,
this
isn't it?
was, yeah. So it just felt like it was just me, a me thing. So nobody
We're
understands.
alone in
Nobody
this
will get
world.
it. Who do I want to tell that I'm constantly bleeding and stuff like that?
I
Or
hear
this
you.
pain. But we all have periods now. You
Why is
understand?
yours? Why is yours extra?
You understand? Is it
Why
not
is
the
yours
same period?
extra?
You understand? Exactly. So I just felt like nobody gets it. So there was no one for me to talk to be like, "Okay, what can I do?"
So there was no
There
support
has to be
whatsoever.
something. There was nothing
Wow.
other than my husband automatically had 911 automatic speed dial on his phone. That was the only thing support I had when he's in pain.
Wow.
It's just that 911, because there's nothing anybody can do or say to kind of like ease the pain for me. So I think I would have loved to know people that are also or having the same situation. Might not be exactly the same, because there won't be exactly the
Ex-
same situation,
exactly.
but
Not
just to know,
everyone's
oh, this
got
is
both
what I did.
together.
But
This
in
is what I did. This is what I
there
took.
is
This helped me. This
endometriosis
didn't help.
society. There is endometriosis society. The one good about it, they can talk to the people.
Okay.
But one thing also, sometimes they get confused because stage 1 and 2 is much, much milder. They
Dr.
start
Omar,
talking.
are you in a place where you can turn your video on by any chance?
Oh, yeah.
Thank you.
Just 1 second.
I want to see your face. Well, we all want to see you. Hello.
Hello.
Okay. No,
Hello.
carry on. Carry on.
Yeah. So, endometriotic society is the one which people can talk to each other.
Yeah, like a support
But
network,
don't
isn't
be,
it?
yeah, but don't be confused with the one they had stage 3 and 4 endometriosis, with the one which is having only first 2 stages, because first 2 stage is an early diagnosis, treated, doesn't affect that much fertility. May be painful, but because it is on the growing on the nerve and it is very fresh. The one who have today, I had a lady. She has stage 4 endometriosis and she has little pain on the right iliac fossa. And I have done a laparoscopy for her and she's aware of that. She said, but I am not in a lot of pain and all these damage, because she had MRI damage. I did a
Wow.
laparoscopy. There is a lot of damage in her body. But
Whoa.
she said, but I'm not in a lot of pain. I said, because it's all the nerve is dead. So
Wow.
many scarring on the nerve has happened, then eventually you have a dead nerve, so they are not going to be painful. But sometimes they also, unfortunately, they used to that type of pain. There
Yeah,
is a
that's another
special,
thing because women are used to normalizing this pain after a while, and because we
yeah,
have different threshold for pain, people
mm,
just get used to the pain and just carry
yeah,
on living. Or
yeah.
honestly, pain is not something that we. I mean, it's a
No,
sign
It's
that
not
something's wrong,
normal.
but it's not something that we should endure,
yeah,
overly and just make it a lifestyle.
yeah,
Mm.
yeah. That's
And
true.
speaking about lifestyle, tell us a bit about lifestyle changes or adjustment, that can help manage endometriosis symptoms.
The lifestyle is similar to the fibroid,
Okay.
to be honest. Less processed food, weight, less red meat, less too much like dairy. Dairy is not good too much to endometriosis because increase the inflammation. So cooked food, vegetable, white meat like fish and chicken, and of course, I know very well, and by nature proper endometriosis, those stage 3 and 4, they are much slimmer than other people. They are more doing exercise. But because it is inflammatory reaction, they can't take off. So food is very important. Vitamin D, vitamin C is good for those things. But processed food, avoid as much as possible, and red meat. But also they losing a lot of blood, so you have to be careful with the iron. So these are the things.
All right, thank you so much for that. I'll come back to you. Honestly, my question to you when I come back is around the biggest gaps that you've seen, and how women's pain or symptoms have been handled in the healthcare system that we are in. But before that, I was going to go to Bisoye. What would you like? What would you advise someone who's currently struggling with endometriosis and who's doing it silently, quietly? Because earlier on you had mentioned how you didn't get the support as well, also only because you hadn't spoken to anyone. You just thought you were alone in this world going through all of that, and you were having extra.
I think the only advice I can give to anyone that found themselves going through this is to just get a support group, because you never can tell. It is a powerful tool. You might think that, oh yeah, what would just the talking do? It goes a long way.
It does.
It goes a long way for you to know that there's someone that understands you. You're talking and they're hearing you.
And you're not crazy.
There's a difference between when you're just talking. Yeah, you understand? There's a difference between when you're just talking. Everybody say, yeah. But you're talking to people that know, that understand, and they can feel what you're talking about. Goes a long way for your emotional stability as well, because you're not thinking you're mad. Am I making up this pain? Am I imagining it? Because at some point I was thinking, no, is it that because I'm thinking so much about it, that's why I'm feeling so much pain? Because it got to that stage, it's not normal. And, it felt like, was I making up this pain? Or you understand? So knowing that you have someone
second guessing
in the
yourself, thinking,
community, yes, that we can talk to and be like, it doesn't have to be 100 people, just someone that you can call on to, other than your partner, because they don't even get it to start with. So it's just someone that you can talk to say, oh, what's going on? What can I do? Okay, you know what? I tried this. Oh, you're losing a lot of blood. Just be on the lookout for this. Or just like Dr. Omar said, just try to cancel all processed food. Don't do this. Think all those little things. It might seem like, what's the big deal? It is a big deal if it means that you not eating red meat, or you're eating more of the chicken and the white meat will reduce the pain. That will go a long way. That will go a long way,
Thank you.
as well.
And having said that, it's also having the right education, because sometimes we hear all of this, we go on Google, we do all of that, and we get information like, okay, don't eat this, eat that. Also, because, like you said, it's similar to lifestyle change, similar to fibroids, and all of that. I mean, I know I had that because I was trying to have a lifestyle change, but I went to start eating the wrong thing. So it's also having the right kind of education, because I was trying to not take dairy anymore, so I went to soya milk.
And then
combined with coffee,
estrogen.
and that's lethal. That's lethal for fibroids. So having the right education is really, really key. So Dr. Omar, back to you quickly before our time is fast spent. Oh my God! So what's the biggest gap you've seen? In how women with endometriosis has been handled in the healthcare system. And what can women do differently going forward?
Unfortunately, it's an invisible problem. When it is not visible, some mole on your hand or a dark lesion can be seen, but endometriosis cannot be seen. So it is invisible. What you feeling, I don't know. What pain you are on, I don't know. The only thing, for example, is done for the heavy period, they do full blood count and say, oh, you are anemic. That is the only thing. But the main thing in the woman should not give up. women should not give up and should insist that taken seriously. Because unfortunately nowadays, I feel so bad for the patient when they come because they have to wait 9 months for the appointment.
What?
A year
Yeah.
for appointment.
Yes.
A year just for appointment. A
9
year
months.
yes.
Yes. Gynae appointments. Yeah.
Gynae appointment is 9 months to a year. Sometimes I say, I wish I'd been in my 30s. I could have done so many extra clinic just for free, just to see these patients. They come to me, either they insure or pay for themselves, but I feel very sorry for them. I feel extremely sorry for them because this waiting is damaging. This waiting is damaging.
It's worse, getting worse. Can you imagine if it's traveled to an organ and then it's just going?
Yeah. And then by appointment is not mean that finished. Then another appointment for ultrasound, then another appointment if they go through the surgery. Then that will take 3 years, and then from stage 1 becomes stage 4. That's a gap. That's a gap.
Wow.
Yeah.
Wow. Thank you so much. This is amazing. I mean, I wish we don't have to finish this conversation. Wow, 1 hour is almost gone. Wow. Knowledge is power, but also more importantly, taking action is where the transformation is. Wow. Wow. Thank you so much.
Quickly, we'll just take quick
Thank you.
questions.
Yeah.
Sorry, because I was seeing the other time and Dr. Omar's line went off there.
Okay.
So in terms of is it cycle? If you're having irregular cycle, an example would be having a 20-day cycle instead of a 28. Is that normal or abnormal? Is that worrying, or should I say, okay, that's a sign?
From 21, if a woman have a 21-day cycle and the other one have 35-day cycle, it is normal. But if
21 is okay.
21 is okay to 35. If someone have 35-day cycle and the other one have 21 cycle, is normal. But if become less and you're having like every 2 week bleeding, that there might be something.
Okay. Got it. Got it. So it's not a sign of endometriosis. I was thinking maybe that could be like a sign, because I always know that, okay, the period cycle should be 28 days and above.
Not everyone the same. Not everyone
has
same.
28 days. Yeah.
No, everyone
over 28 days. Wow. This has been a very interesting conversation to have this evening. And some of the things I discovered today about endometriosis. Oh, wow. As we close, I want every woman listening to hear this clearly. Honestly, your pain is valid. Your voice matters, and you deserve proper care. Get a support network, get a support group, whatever your condition. Today we're talking about endometriosis. Join the support group that is available around you, and get help. Honestly, and at the Feminine Health and Fibroid Network, this is what we continue to do, to advocate, to educate and amplify women's voices until women's health is no longer overlooked. And I'm really thankful for both of you for this conversation. I think we should have, past endometriosis awareness month, we should still talk about endometriosis more, because some of the things I found out tonight, I can imagine women who have been diagnosed and all of these symptoms are the things that they're having to deal with. They don't even know to go and have to check for this. So I think it's something that we should really come back to. Have another conversation around it. Thank you so much. And whoever will be listening to this, share this conversation with at least another woman. Subscribe to our channel. Follow us on the Feminine Health and Fibroid Network, and let's know what you want us to talk about next. We just want to carry on this conversation so we can normalize talking about these things, and women can feel confident and know that they're not alone. Sometimes we're there in the corner thinking, oh, this is just me, and we're isolating. We can get into talking about it and get the help that we really need. Thank you, both of you. You've been amazing tonight. I am absolutely thankful.
Have a
Thank
good
you, everyone who
night.
joined us tonight.
Good night.
And please, let's learn, let's speak up and take control of our health. Good night, and thank you.
Good night.
And remember, understanding your body.
Thank you. Good night, everyone.
Good night.
Have a
Good
good
night.
evening.
Yes.
Thank you so
Thank
much.
you. Good
Thank you.
night.
Bye.
Hope
Happy
you're
good
Bye.
well.
evening,
God bless.
everyone. Bye.
Bye bye.
Bye. Bye.